Dialectical Behavioral Therapy for Post-Traumatic Stress Disorder by Daniel Tapia. To understand what dialectical behavioral therapy for post-traumatic stress disorder is, we would have to first understand what dialectical behavioral therapy is. And what dialectical behavioral therapy is a emergence of the emotional mind and the rational mind. Your emotional mind is everything that has to do with feelings, anger, anxiety, sadness, fear, or stress. And your rational mind is everything that has to do with statistics and logic and research. So, your wise mind might sound something like this: I feel like this, and I know this, so I will do this. It started from, it stemmed from cognitive behavioral therapy. It was developed in the 1980s by Dr. Marsha M. Linehan to treat by borderline personality disorder. The difference is um, cognitive behavioral therapy focuses on thoughts and behaviors, while dialectical behavioral therapy puts an emphasis on feelings and emotions. DBT is creating a balance between our rational minds and our emotional minds by strengthening our wise mind. Dialectical behavioral therapy, post-traumatic stress disorder. So now we're going to go more into detail about what it is. So first, we have to understand what post-traumatic stress disorder is, and it's a disorder in which a patient lives in constant state of distress due to an experience or event that was traumatizing. So PTSD means living in a constant state of survival mode. PTSD means living in extremes reactions. So emotional reactivity or emotional avoidance, compulsive behavior or impulsive behavior, excessive intimacy or excessive independence. So it's kind of living on the extremes of everything instead of having some sort of balance. So DBT for PTSD tries to combat these feelings of distress, anxiety, and or fear, and replace them with healthy feelings. Treatment structured. So the way it's structured, it's uses four different types of techniques called emotion regulation, mindfulness, distress tolerance, and interpersonal effectiveness. So the first technique that we're going to be talking about is called emotional regulation. So in emotional regulation, we are learning to overcome and effectively manage emotional experiences. We learn that feelings are not wrong, and we also learn how to react to feelings and how that's important. The second technique used is called mindfulness. Mindfulness is increase awareness of the present moment without judgment. Increase awareness of cues and triggers and feelings in terms of PTSD. So in PTSD, we might be triggered by many people in a social space. So mindfulness teaches us to be in the present moment without judgment. So we might start feeling anxiety from being in a social setting. So mindfulness teaches us to use our five senses to be present in the moment and not think about the stress. The third treatment option is called interpersonal effectiveness skills and interpersonal effectiveness. So it's we're learning to cope with conflict, we're learning to build healthy relationships and make healthy and functional choices. Sometimes, and the fourth technique is distress tolerance. So we're learning to tolerate stress. We're learning to not make a stressful situation worse. We learn how to manage our emotions and what is actual danger and what is perceived danger. Trauma related symptoms treated. So some of the symptoms that are treated with DBT for PTSD is helplessness, fear, anxiety, anger, guilt, depression, suicidal thoughts, self loathing, and even addictions. Some research studies that I looked into was one where it's a clinical trial for women with childhood abuse related PTSD, and they compared DBT PTSD with cognitive processing therapy. And the results favored DBT over CPT and proved that PTSD related to childhood abuse could be managed efficaciously. The techniques used in the study were cognitive behavioral techniques. A second study was a randomized controlled clinical trial for a treatment program specialized in clients with PTSD after childhood abuse. The study focuses on the program's efficacy in outpatient setting and to study intrusions and dissociations after child abuse. Techniques used were mindfulness, exposure, emotion, emotional regulation, and more. The study aims to conduct further research on DBT PTSD. Some more research studies that I looked into were in a clinical trial, P- DBT PTSD was compared to treatment as usual. The results show that DBT PTSD outperformed treatment as usual in reducing trauma related symptoms. Adherence to treatment by the client could have affected the results. So I think just proves that it is important to make sure that the client wants treatment because it can really affect the outcomes of the treatment and how successful it is. The last clinical case study I read presents a connection of a person that suffered childhood sexual abuse with their feelings of obligation to perform unwanted sexual activities in order to gain affection or prevent abandonment. The study managed to change the client's engagement in risky sexual behaviors and maintain a satisfying relationship. Some of the techniques used were emotion regulation, exposure, reduction of harmful sexual behavior. So, the ideal client for dialectical behavioral therapy for PTSD is anyone that has been through a traumatic event in their life, anyone that has been diagnosed with PTSD, anyone that has been diagnosed with depression, anyone that has been diagnosed with substance use disorder, anyone that finds themselves struggling with suicidal ideations, anyone that finds themselves struggling with an eating disorder, anyone that struggles with any type of anxieties, and much more. What more would I like to learn about DBT PTSD? I would love to watch live sessions of a therapist practicing DBT on a client with PTSD. I would also like to watch a live session of a therapist practicing dialectical behavioral therapy on a client with other disorders other than PTSD. I would also like to read more studies that focus on DBT on specific types of PTSD, incorporating different variables. Thank you for your time. And this is my reference page.